One of the great things that I pride our practice on is communication. And being involved with the oncologists, the hematologists, as well as the reconstructive surgeons, we're involved from the get-go. So before the surgery and the radiation and the chemotherapy takes place, I'm involved. I see that patient preoperatively, do my proper diagnosis and record taking so that I'm prepared when this individual has completed their treatment, we could start and we could move fast so that this patient is not without teeth. And a lot of times we are presented with patients with very difficult anatomy. And what do I mean by that? If a patient has had cancer of the jaw and they've had a significant portion of their jawbone removed, and we're presented to reconstruct, we have to think outside the box. One of the ways we think outside the box is the utilization of zygomatic implants. What do I mean by that? Well, the zygoma bone is your cheekbone. And implant companies, pharma companies, have developed and manufactured implants that aren't your traditional implants. Traditional implants are about 10 millimeters long, the size of your thumbnail. Zygomatic implants range from 40 to 55 millimeters. So we're able to reconstruct this patient utilizing these resources available to us and the technology available to us to place these implants in strategic positions and give the patients back teeth that they normally wouldn't have had 5-10 years ago. And recently I had this young woman who unfortunately suffered domestic abuse and violence. And she came to me literally with no bone. So we had to think, how could we help her? One of the ways was utilizing the zygomatic implants to reconstruct her. And when I tell you how happy she was afterwards, suffering through this domestic violence and giving her a solution, it's like a new lease on life.